Have you ever felt like there's something else going on, some hidden factor that might be affecting your chances of getting pregnant? Well, today we're tackling a huge question. Could chronic inflammation, this kind of silent process happening inside all of us, be secretly hijacking your fertility? Let's get into it. So let's start with a really powerful story from Dr. Natalie Crawford. Now, she's a fertility specialist, but while she was still training, she went through 4 pregnancy losses herself. And the answer she got? Bad luck. As a scientist, and especially as a patient, she just didn't buy it. And that refusal to just accept that answer, well, that's what led to everything we're about to talk about. All right, here's our game plan. We'll start with Dr. Crawford's story, then we'll break down what chronic inflammation actually is, with a pretty cool analogy. From there, we'll connect it to something called insulin resistance, and then, the important part, we'll lay out a 5-step action plan. And finally, we'll talk about how all this helps you take back control. Okay, so just try to imagine this for a second. You are training to become a top fertility doctor. You're helping people build their families every single day. But behind the scenes, you are going through the absolute heartbreak of losing pregnancies over and over and getting this vague diagnosis of unexplained infertility. I mean, that was Dr. Crawford's reality. Talk about a tough spot to be in. So, feeling totally disempowered by that bad luck diagnosis, she did what any good scientist would do. She went straight to the research. She started digging into everything, vitamins, environmental factors, you name it. And as she was connecting the dots, one word just kept popping up, linking everything together: inflammation. It was this huge potential culprit that, crazily enough, nobody in the clinic was really talking about for fertility. So what is this hidden culprit? You know, the word inflammation gets thrown around a lot, but it's so important to know that there are 2 totally different kinds. You really got to see the difference here. On one hand, you have acute inflammation. Think of it as the healer. You get a paper cut, your immune system rushes in, it fixes the problem, cleans up, and leaves. It's a good thing. But then you have chronic inflammation, the hijacker. This is when your immune system gets stuck in the on position. It's just humming along at this low level all the time, causing this constant wear and tear on your body. Okay, so how does this low-grade hijacker actually mess with something as complicated as fertility? To make this super clear, Dr. Crawford uses this brilliant analogy about an airport. Okay, picture this. Your brain is air traffic control, sending out super precise signals. Your ovary is the airplane, and it needs to get those signals perfectly to do its job. Now imagine chronic inflammation is a massive, nonstop hailstorm. During that storm, it's almost impossible for the plane to hear the commands from the tower, right? And that's the core of the problem. The inflammation isn't just scrambling the communication. Over time, that storm damages the plane itself and the runway, making everything that much harder. So we know inflammation is the problem, but what's causing the hailstorm in the first place? Well, one of the biggest drivers of that chronic inflammation is something a lot of people have and don't even know it. It's called insulin resistance. So, in simple terms, insulin resistance is when the cells in your body basically start to ignore the messages from the hormone insulin. This causes a big traffic jam of sugar in your blood, and your body's response is to just scream louder by making even more insulin to try and get the message through. Let's break it down with another great analogy. Imagine insulin is a salesman. He knocks on your cell's door to deliver glucose, which is the cell's food. At first, your cells are like, "Great, come on in." But what happens if that salesman starts knocking on your door every single minute of every single day? You'd stop answering, right? You'd pretend you're not home. That is insulin resistance. The cells are now starved, they send out distress signals, so your body releases more glucose and more insulin. Now the salesman is banging on the door, and this whole chaotic cycle creates a massive amount of inflammation that directly hurts your ovaries and your egg quality. Now, what's really important to get here is that this isn't some hopeless situation. Because we understand this whole insulin thing, we have a clear target. We can actually fight back. And that brings us to the anti-inflammatory action plan, which is built on 5 non-negotiable pillars of health. These are the big 5, the core areas where you can make choices every day to bring down your body's inflammation levels: sleep, movement, stress, diet, and cutting back on toxins. Let's jump into the first few. First up, sleep. The number you need to remember is 7. 7 hours is the absolute rock bottom minimum your body needs. Why? Because sleep is when your body does its repairs. It's when it naturally lowers inflammation and resets everything. In fact, studies show that for every hour of sleep you get less than 7, you produce fewer eggs in an IVF cycle. That's a huge deal. Okay, pillar number 2 is movement. And the key number here is 3. That's what you're aiming for, at least 3 strength training sessions a week. And listen, this isn't just about being fit. There is a very specific and frankly very cool reason for this. Here it is. Your skeletal muscle is your secret weapon in this fight. It has this amazing, unique ability to just pull glucose straight out of your bloodstream for energy without needing that insulin salesman to even knock on the door. So every time you build and use your muscles, you are directly fighting insulin resistance and helping to break that whole inflammatory cycle. Pretty cool, right? All right, on to pillar 3, stress. The number to think about here is 20. The goal is to carve out 20 minutes every single day for something that helps you chill out and release cortisol. It could be a walk, meditating, writing in a journal, whatever works for you. It's the consistency that matters because it retrains your body to handle stress better. And this leads to a really practical tip. When you get stressed, your body dumps sugar into your bloodstream. It's that old fight or flight thing. So instead of reaching for a snack or a drink, which just adds more fuel to the fire, use your secret weapon, your muscles, to burn off that stress sugar. Seriously, a quick 5-minute walk or even just banging out 10 squats can make a huge difference. And finally, let's talk about diet. Look, this isn't about being perfect. It's about following some simple, powerful rules. Try to get 2 servings of fruits and veggies with every meal. Go for complex carbs like sweet potatoes that don't spike your blood sugar. When you can, swap in some plant-based protein. It's been shown to improve ovulation. And, try to limit the stuff we know drives inflammation, like red meat and super processed foods. Okay, so we've gone through the problem, how it works, and a plan to fix it. So what's the big takeaway here? What does this all boil down to? Really, it's about one thing: taking back control. So let's be really clear about this. The goal is not perfection. Life is going to be stressful. You're going to eat cake sometimes. You'll have nights you don't sleep well. It happens. The real goal is to make positive choices most of the time so you can build up your body's resilience. That way, when life throws you a curveball, your body can handle it without getting stuck in that inflammatory state. And at the end of the day, this information is not meant to be another thing to stress about. It's about empowerment. It's about giving you the tools to understand what's going on in your own body so you can make choices from a place of knowledge and power, not from a place of fear or feeling like it's all just bad luck. And that kind of leaves us with a final thought to chew on. Instead of looking at this whole fertility journey as just a struggle, what if we reframed it? What if this challenge is actually an opportunity? The push you needed to build the foundation for your healthiest self, not just for fertility, but for the rest of your life.